And one of the beautiful things I saw on my somatic course was somebody working with somebody with back pain who had recurrent back pain for years, and they're supporting it, and this memory comes up for her, and it was just like there wasn't a dry eye in the room, where this woman comes up, and the memory of having an abortion when she was 19 was just like, it was just being held in there, and just hadn't been supported like on a body level there. On a mental level, on a cognitive level, she can talk it out and kind of understand it. But for the body to just be holding that, it was just beautiful.
Welcome to the Radical Health Rebel podcast. I'm your host, Leigh Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this week's episode, I spoke with somatic healer Liz Wong. Liz and I first met way back in 2001 when I was her examiner when she was taking her American College of Sports Medicine exams. Our paths would cross several times over the years in the same professional classes or working at the same facilities. I was also present at a psychic circle in London when Liz shocked an entire room of professional psychics. Such was Liz's gift to be able to see beyond the physical, which came as a real shock to Liz too at the time. In this episode, I focused on asking Liz about one of her skill sets, somatic healing, and we discussed her traumatic loss in her own life that led her to find somatic healing, why she became a somatic healer, what somatic healing entails, and how she uses the techniques to help her clients. And of course, I didn't let her off the hook. I also asked her about the time she shocked a room full of psychic professionals. So I really hope you enjoy this episode as much as I did. Liz Wong, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thank you for having me, Leigh.
Yeah, it's really good to have you on the show. It's been a while, isn't it, since we last spoke?
It has been, but we keep popping into each other's lives every now and then.
We do indeed. So Liz, can you share with the audience your journey from the personal trainer that I remember meeting in 2004 with your degree in sports science and masters in psychology and health? And I know back then you already had an interest in the root cause of pain, up to today where you are, the somatic healer, shaman, energy healer, and the end-of-life doula. So can you explain to us your journey?
My God, how long have you got? I know you said we've got I can talk for 5 hours, so it might be like that. I met you. You were my examiner for ACSM back in the day, and we met at HLC 1, and I think that started my Czech journey. Mm-hmm. And in that, we learned more holistically about what's happening in the body and the root causes of pain. And so, doing all the exercise correctives, mobilizations, found that you can help people with their back pain, knee pain, all those sorts of things. But, I always had that question, like, where is this really coming from? And through my own experiences and my own journey, is that coming to this place of going, well, I think it's actually, there's an emotional element here that we're not really looking at. So we can stretch and mobilize for the rest of our lives, basically, because that element hasn't really been looked at. So that's brought me into, questioning things more. In terms of like the shamanic work and things like that, I think, again, you're like a key person in all of this. That time I gate crashed your trip to the psychic, what was it, a psychic circle? Yeah. I was just like, I like the sound of that. I want to come to that. Like you witnessed, like in that circle, I had verbal diarrhea when we had to speak about this person. And it was just like, where did that come from? So, getting to learn about my sensitivities, and being around people that weren't afraid of it, also had similar experiences to me, like a friend, Paula Shaw, that you also know. She was really cool with like tarot readings, talking about feeling ghosts, spirits, and things like that. So yeah, started to really be okay with it, normalizing my experiences and not being like, I'm just a scaredy cat and weird stuff's happening. And I mean, still now I'm quite a skeptic. I'm still like, even with the experiences that I have, I'm still kind of going, is this really, really real, and things like that. So that kind of led me down, okay, let's learn more about this, go on shamanic workshops, learn about that, and then seeing the effects of it in real time, like, blew me away. And then I had the death of my best friend, and she fainted and had severe brain damage. And in that moment, I knew she wasn't going to be coming back. And in that experience, my friend and I, Steve Nobel, we were going down to Glastonbury. And, it's like Mist of Avalon. There was one point where we drove in and I had just got the message that my friend had gone into a coma. And it got really misty. And my friend was just like, can you feel that? And I was just like, I can feel her. I can feel she's here. She's not coming back. She's getting cleansed by all these beings. And at this point, I didn't know much about Tibetan Buddhism, the bardos and things like that. But the experience was very much like there's beings with her being cleansed. There's all these different colors, all these different lights. And there was this deep knowing that she was not going to be coming back. She was not even going to be reincarnated into another life. And for some reason, I knew that it was just like, I just know this. And my friend Isga, who passed away, she was a student at the Barbara Brennan Healing School in Austria. And one of her mentors had actually trained with Sogyal Rinpoche, who wrote the Tibetan Book of the Living and Dying. And she was a death midwife. So she tracked her. And apparently my experience of what I felt, she also witnessed. So again, there was this experience of like, what is this? What the hell? What did I experience? And then goes the journey of more shamanic journeys, psychopomp work, space clearings. So I started doing space clearings. Again, you come into this because it was through working at the Albany Club, where you were at as well, that I met somebody I did a swap with, and she asked me to do a clearing in her flat. It went really well. Her child then slept in his room for the first time ever, felt really comfortable in his space. She then asked me to do a space clearing at her mum's house, and freaked me out. It freaked me out. It was like a train station of spirits. And it just got me to this place of going, I don't know what I'm dealing with here. Because also, like in Tibetan Buddhism, I was told by somebody, I'm dealing with hungry ghosts here. So yeah, it put me into this place of, I don't know exactly what I'm dealing with here. There's these energies. What is this? And yeah, I got completely freaked out, basically. So I kind of stopped that and almost shut all of that down. And I went down the route of, because in my experience in those worlds was that there were so many lost souls for whatever reasons. I mean, we can talk about how, we're dying and it's a taboo. We don't talk about death and dying. People are dying scared and they're not able to talk about it with anyone. People are dying completely drugged up. So the idea for me is that when they pass through on the other side is that they're really unaware of where they're at. So they're these lost souls. And in one experience with my shamanic teacher, I'm standing on this mountain and there are just a sea of lost souls, because we've also lost the shamans, the exorcists, priests. One of the reasons why I got called in to do these energy clearings was because this woman had contacted Catholic priests who would be the people to go to, and they weren't doing them anymore. So there was just all of that. And So having that really scary experience as well, and just not knowing what I'm dealing with, stopped it all and just thought, I want to deal with the living. I want to deal with the living. Please don't send me any more like spooky dooky stuff. Switched all of that off. And then went down the road of the end of life training to be an end of life doula, supporting people going through that process, understanding it more. So those are one of the reasons why I did it. Other reason is that, the idea of my parents dying scares the crap out of me. And I always felt like I just have no skills in that area. I don't know what I would do. So that training really helped me to just go, okay, well, there's the practical side. I'm going to understand, like, this happens when you're dying. That happens when you're dying. This bit I can probably help with. That bit I can not so much, and things like that. So it kind of just gave me like life tools that I can support people I love as they go through that process. Because I know for myself, it's going to be emotionally really hard. So yeah, that's where the end of life stuff came in. And I suppose with the somatic work, where that comes in with when my best friend died, it was such a shock to my system. I contacted a friend because I was like, oh, he's got a really good craniosacral therapist. And when I spoke to him, he was just like, what do you need? What's happened? And I said, well, my best friend died pretty suddenly. I find myself at night, like, not breathing, just staring in like a deer caught in the headlights. Like something's not okay. And so he steered me towards somatic experiencing, which is something that was developed by Dr. Peter Levine. It's all about like the natural body's way of healing, of moving through trauma, the support that we need for trauma, shock trauma, medical traumas, things like that. So he's really looked into like the physiology, the neurobiology, our nervous system, how it gets affected with trauma, and how to support people through that on a felt sense. So soma is the felt sense. So it's all a bottom up approach. So yeah, just, when they start talking about a trauma, the hands might start going and to look at what the body's expressing. So getting them to slow it down and really being with that expression, and it leads to other things. And then they'll find, oh, actually, there were some resources there. There were some other things I could have done there. And, and then getting them to imagine that and have some sort of completion where there's more empowerment, as opposed to that trauma where you're just left with, not knowing where you are, not being completely disempowered in it. So, yeah, so it kind of I've gone into that world. That's really supported me. I really saw the benefits of that for myself, for my nervous system, started to look at other people's nervous systems, like understanding them from that level. And then I did the 3-year training for it. And then going into that more, learning more about the relational element, and just really seeing how people need support. Like, as personal trainers, as Paul Chek would say, we people aren't seeing you for exercise. They're not seeing you to like complete their goals. Like on a deeper level, there's that love and connection, and how, as a personal trainer, we have to be so attuned to the other person. And I think an attunement is the main thing that we're missing when we experience trauma. So yeah, I think as PTs, we kind of get that, how that hour that we have with that client, we're there for them 100%. We're aware of that weight's too heavy. Let's bring it down a bit. Okay, you're getting to, a really high level, pushing yourself quite a lot. Let's just drop it back down a bit. And, we're really tuning into where they're at. So on a somatic level, I've transferred it, I suppose, to a more therapeutic setting.
Yeah, I want to take you back. So now as you know, I don't remember the first time we met in 2001 when I was your examiner. When did you start in the fitness industry?
I started when I was studying for my master's in psychology and health. So I went straight out of uni, did my 3 years of sports science, didn't know what I was going to do, and then went into the master's for psychology and health, which was just a 1-year course. And during that time, I went and worked part-time as a fitness instructor at Cannons.
Mm-hmm.
And then after that, I went traveling with my best friend, Uzge, and then came back and I was just like, I want to be a personal trainer. So I went and did the ACSM where you were at and carried on.
Okay, so that's when you started.
Yeah. So it would have been like 2000, 2001.
And what got you into that in the first place? What got you into doing that degree, and what kind of got you into working in health and wellness? What was the motivation for you?
I think for me, like even just doing the sports science degree, I really like science. I really like biology. Biology was one of my favorite subjects at school. And then I really like sport. I found I was quite good at it. Any sport, I really enjoyed it. And so, yeah, just combined the two and did sports science, and then went from there. And I think just getting that part-time job working at Cannons in London and just having a laugh. It was just such a fun environment to work in, and then learning more about Czech stuff. And I think there's always been a thing of just wanting to help people, finding, there's a bit of a helper in me. So, and then finding I like to tell people what to do, so it works quite well. I get to be bossy. People do as they're told, and I'm moving around. I don't think I could have ever done a 9-to-5 office job. I don't think at that age, definitely not. Wasn't for me.
So what attracted you to studying with the Czech Institute?
I think at Cannons, I was aware of it from various people that started doing, the Swiss ball came out loads, and all of us were learning different things, having fun on it, and then learning from a particular person who was really into, studying, and telling me about Czech. And so started doing the online, well, not online, when you used to get the videos.
Correspondence
courses, that's it, like the Swiss ball conditioning and things like that. So it started on that level. And then when I went to work at a club, they offered to pay for training, which was great. So I chose the HLC one, which, that was years ago. I don't even think it's called HLC anymore, is it?
No, it is. Yeah, it's still called it. Yeah.
It is. Yeah.
Yeah, I think when we did it, it was actually called Nutrition and Lifestyle Coaching.
That's it.
But they changed the name to Holistic Lifestyle Coaching.
Yeah. So that kind of started the journey of, okay, there's these people that are actually really committed to making change, or to like going organic. I mean, back in the early 2000s, you wouldn't see much organic in the shops, and compared to now. And like seeing people go, okay, it is possible. It is possible to do this. And, learning things about organic milk and butter versus margarine, like those sorts of things blew my mind, because, everyone was having flora and stuff, and just the idea that flora is good for you and things like that. So it was really, really cool, really opened my mind to just like, no, there's another way. And I think that's a key thing for me. Like, there's just another way. There's another way of being. It doesn't have to be like this. There's actually a better way. So, yeah.
So one of the things I know about you is you've always had an interest in the root cause of pain.
Yeah.
Where does that come from?
So just asking I'm just very inquisitive, I suppose, and just maybe a bit nosy. Just want to get into it more. I don't know. I don't really know how to answer that. I suppose there's always just been like, there's something else here going on. I think that intuitively, like tuning into people's back issues, their back pain. It's like you tune in on an energetic level, or tune in with your hand there. It's just like there's something else going on in here. There's like no support. And one of the beautiful things I saw on my somatic course was somebody working with somebody with back pain who had recurrent back pain for years, and they're supporting it, and this memory comes up for her, and it was just like there wasn't a dry eye in the room, where this woman comes up, and the memory of having an abortion when she was 19 was just like, it was just being held in there. And just hadn't been supported like on a body level there, on a mental level, on a cognitive level. She can talk it out and kind of understand it, but for the body to just be holding that, it was just beautiful. So yeah, things like that. It's really kind of confirmed to me that there's more. There's I'm not saying that it's 100% always going to be emotional. I'd like to say that confidently, but I don't have proof, so I can't.
Yeah.
But to just say that there is always, I'm going to say it. There's always an emotional component to it that we're not looking into, or not many people are looking into.
So would it be fair to say, based on what you just said, the reason why you've been so interested in the root cause of pain is because if you don't look for the root cause of the pain, you're not going to be able to actually help people?
Yeah. I like efficiency. I think that's what it is. I like efficiency. I like the exercises where, you hit on so many areas and gets to things. So that on a PT level. But yeah, I don't like wasting time. I like to, why not come from that place and work our way out? So yeah, I suppose it's the thing of, I like efficiency. I like to get into things and just, make sure we cover all bases. The nutrition can come into it. People with trauma can be missing loads of stuff, not helping them to deal with inflammation and things like that. So we've got the nutrition side of things. We've got the talk side of things is still important, but the body up approach, the supporting the actual area, the nervous system that, we get frozen parts of our nervous system telling different stories. And it's just holding that space to allow that story to emerge and be heard and be held.
So just looking back, so 2001,
yeah,
you did your American College of Sports Medicine.
Yeah.
2004, you started studying with the Czech Institute. When was the time when your best friend passed?
That was 2012. Right.
Okay, so 11 years ago.
11.
And then when did you start the somatic therapy training?
I did somatic therapy, when my friend died. So 2012, saw various people and then, had other stuff happening where I was just like, I need more support. So it's like, there's stuff going on. My body's not handling it. And so then I committed to seeing somebody quite regularly and just found like, a breath. It was just like a breath of fresh air. Like finally my body I wasn't freaking out, like on high alert anymore. Finally, like I think of my first session of somatic work, just after my friend died, the question is, what are your resources? Can you think of a happy place? I couldn't think of anything. I was just in bits. I just cried my eyes out. I was just like, I don't have anything. And in my head, I was like, I do have somewhere. I'm pretty sure I do have somewhere. I had nothing. And then within about 3 weeks, and I also did something called tension release exercises, TRE. I did that as well. And it was like the next day, the combination of the two, I was just like, I've got loads of resources. These are my happy places. Finally felt like I could breathe from my diaphragm again. So yeah, massive difference there. Really showed me the power of working on that level. Because I'd had, like many of my clients, they're like, I've had loads of talk therapy and I just don't feel like it hits the spot. Like I can understand things, I can talk things out and make sense of it. But there's still stuff going on in my body where the anxiety can still kick in and something just doesn't feel right. It feels overwhelming. So yeah, I just found the power of working on a body level, on a somatic level, somatic therapy. Just really that missing piece for me, I suppose. Yeah.
So some of the symptoms that you described then, so you mentioned anxiety, brain fog, couldn't breathe properly. What other kind of symptoms, like physical symptoms, did you have?
Physical symptoms of stress disorders, where you've got people get migraines, people get pain, spasms, trembling in the arms, chest pains. They can feel their heart rate go up, sweatiness, just blind panic, tightness in their diaphragm, so maybe up here the thoracic outlet, and also further down below. What other things? They could have chronic illnesses. I mean, if you read what's his name, Gabor Mate, that when the body says no, there's this guy is really linking personalities and stress to chronic illnesses, some big stuff. And then we've got in America, what's a really big thing is the Advanced Childhood Adversity, the ACE, Adverse Childhood Experiences score. And that's linking to illnesses like cancers, chronic heart disease and things like that. It's really showing how trauma can affect us in the long term, really bad physical health, basically.
Yeah. I mean, I know from my studies of the body talk system that, your body will store trauma literally anywhere in the body.
Yeah.
Well, it's normally in the fascia, but, the fascia is everywhere in the body.
Yeah.
And it's interesting that you mentioned the diaphragm, because, of course, the diaphragm is a very emotional muscle in the body, and that it's known as the halfway house of emotions.
Yeah.
So it's no surprise that, if someone's experienced trauma, that there's going to be an issue with their breathing.
I'm curious with the halfway house. Why is it a halfway house?
So basically, when you have an emotional experience, let's call it, the emotion first goes to the diaphragm. It's the first place it goes. And then what should happen is, depending on the emotion, it should go to a specific organ in the body, or it can come straight out the mouth. So, for instance, if you stub your toe, you might shout, "Ow!" Right? That's one way of getting it out. I tend to do that when I play a bad shot playing tennis. But now the anger's gone. Right? It's out. Or the other thing that can happen is an emotion can be digested by the intestines. And quite often when you digest an emotion, you'll hear your tummy rumble or gurgle.
Yeah.
But obviously the most kind of negative response is for the emotion to be stored in the body. You want it out of the body, right?
Yeah.
So 42-year-old Chris came to see me whilst training for his first marathon. Initially, Chris wanted manual therapy on his calf muscles, which were taking a pounding from his long runs. I did recommend to Chris several times that he really needed a full exercise, nutrition and lifestyle program so he could complete the marathon in the quickest time and to minimize his likelihood of injury. However, 6 weeks from his first race, Chris suffered a debilitating back injury that meant he was unable to walk and was devastated that all his hard work had gone down the drain. Chris hobbled into my treatment room the next day to see if we could salvage the situation. I suggested to Chris that he do what I recommended all along, and if he did, he'd probably have a 50% chance of completing the marathon. So I've gave Chris a full physical assessment and then devised a comprehensive exercise, nutrition and lifestyle program. And full credit to Chris, he gave it 100%, totally dedicating himself to the program. Days before the race, Chris came to see me for a final tune-up and to ask whether I thought he was ready for the race. I suggested he start the race, but to stop if he felt any back pain, as there will always be other races. I received a text message from Chris the afternoon of the race to say that he completed it in 3 hours 42 minutes and he had no pain and had little to no muscle soreness. Chris has since gone on to run multiple marathons in impressive times. So if you're suffering from back pain that's preventing you from doing something that you love, why not arrange a consultation with me at www.bodycheck.co.uk so I can show you what's causing the problem and how you can get back to performing at your best. Now, back to the podcast. You've mentioned a little bit about somatic therapy, or you've been explaining somatic therapy to a degree, but if someone's listening to this and they've never heard of somatic therapy before, how would you describe it to someone?
I'd describe it as a body-based approach to therapy. So you're going to have your talk therapy, which is like psychotherapy, counseling, CBT. We talk about that as being a top-down approach. Mm-hmm. So it's about talking about your issues and making sense of them. So the difference is on a somatic level, it's a body-up approach. So it's going with the body. So a lot of the time, I'm not too focused on the story. I'm more focused on what's happening in the body as the story is being told. What's the response? What's the reaction? Notice what that is. And then to support it from that level. And what I find really interesting in it is that from it, people make their own sense of it. Like from being with that, tracking what's going on inside. And, and resourcing as well. Like sometimes that stuff is big. There's a reason why we're not feeling it. It's too much. So with the somatic work, what's really key is what we call titration, where we drop it in a little bit at a time, not too much. And to really track where that person's at, like really check in, like, is this okay? If it's too much, we switch it up, we take a break. Because as soon as we bring awareness to that area, we're already, feeling it, moving it, being with it. So we can take breaks. And often, we know how to shut it down. That's something we can all do very easily. There's ways we do that. So bringing that in as a resource of, if it gets too much, exactly how to shut it down. Just go for it, do it. So there's a lot about, taking care of that person where they're at. They're not going to do anything they don't want to do. So there's a massive consent piece. It's really supporting the person, the body and the person. So you can have somatic therapy with people that, it's really focused on the body. And then there's other forms as well, which make it a bit more relational. So there's a form called Neuroaffective Relational Model, NARM, developed by Lawrence Heller. He brings in more the relational aspect, how you feel about that. What's your relationship with that? What I tend to find with people is that who are really struggling and they've got the anxiety, they've got all these stress disorders going. A key thing that's happening with them is that their relationship with themselves, their relationship with having these emotions, their relationship with anger, which is normally a big one, where we're not digesting it. We're kind of, shutting it down because it's not been safe. And so when we look at that, it leads the story can come out that, when they were little, if they were angry, if someone was angry when they was little, they were probably told off, shut down, or, put in a room, go to the naughty step. So the message is that you're not allowed to experience this. You're not allowed to have anger. It's not safe to have anger. Because if I have anger, I'm then naughty. I'm then disconnected from my primary caregiver, whoever that may be. So there's this relational aspect as well, which tends to show up a lot. Like you can have people that come in for like a medical trauma, but what we find is that we're going back to childhood. Like how were they supported when they were in need? Were they able to express their need? So a lot of the time we're supporting all of that before we even get to the piece that they've come in for. Mm.
So can you walk us through perhaps an example of a specific client? So obviously you don't need to mention any names, but say for instance, okay, Bob came to see me. Bob had whatever it was. The first thing I did was this. And what we found was this. And then the next thing we did was, can you kind of walk us through an example?
Yeah, I suppose, I can give you more of a general idea of what happens. Like when I see somebody, I will send them out the intake form, right? Questions that I will ask them. Because oftentimes just these questions activate us. Just them bringing it up, and even just having a 20-minute phone chat with them brings up a lot of emotion. And even there, you know, to show them techniques of, okay, we're just going to slow it down, feel the chair, feel things like that. So in the first session, you know, we're doing an intake form, and even in that, I'm watching their body and watching how they're responding and slowing it all down. So we're not just rushing through it and just being with it all. So like you want an example, if I think of somebody, I mean, I had a really beautiful experience yesterday with somebody. So I had somebody who we've been working for a while, and actually normally at the beginning of a session, I would say, is there something you'd like to work with? Is there something, how would you like to spend the time together? And with this person in particular, they were just like, actually, things are pretty good. I don't really have anything. And I was just like, okay, let's be with that. And then into that, she'll come up with, you know, actually, I realized how I realized my past experiences don't have to take me down anymore. They don't affect me as they used to do. And then it will just be like, okay, so notice that. And then this massive breath comes in. And she's like, it's such a relief. It's just such a relief to know it's not going to take me out anymore. And it's just like, okay, can you stay with that? And as we let that relief come in, and so, you know, I usually say something like, allow every cell in your body to experience that relief from having been on alert. And she'll even mention, you know, I've been on alert for 50 years, and finally I don't feel like I need to do that. And it's like, how is it to just stay with that? So we stay with that. And then what's really nice, well, not for me to witness, maybe not for her, is that her body starts to do this thing we call like pendulation, which, you know, our bodies should do really, but we kind of forget to because we've repressed it. So in this pendulation, she's nice and resourced, she's in this positive place. And then a bit of activation comes in. She starts to remember something, and then the constriction comes in. She says, oh, I just remember, you know, having photos taken and my body's all constricted. I'm having to smile and put on a show. And, you know, I've got this image of me as a little girl, just, you know, and all this. And I was like, oh, what's it like to be with that? She's like, oh, yeah, I can feel the constriction again. And I was like, is it okay just to allow that constriction to be here? Let's be aware of the part of you that didn't want to be in that position. You know, and then she stays with it, and then gradually posture starts changing and hands start opening up, and then she's like, oh, there's another memory now of this, my favorite picture of me and my dad in the garden, and the hands start doing something different. So there's this nice pendulation going back and forth of, okay, there's something nice, and then something triggering comes in again. She's like, oh, Mum's going to come home soon, and the body constricts again. And then it's so what does this part need? This part that's just constricted and scared, what does this part need? And then from there it's just like she needs her own space. And then she'll be like, I really enjoy my own space as much as I love my husband. I love my time by myself. I love it. I love the freedom. And I was like, I feel that freedom again. So there's this nice pendulation where I don't have to do anything. I'm just moving along with them and getting them to slow down. So that kind of happens. It's nice to see that after a few sessions with them. But in the beginning, when I'm working with people, that's kind of the thing I try and bring in, this pendulation of, okay, there's the activation. If there's been an activation for a bit too long, I might just try and resource them so that they can just, feel their resources again. And then when they're up for it, just like, would you like to just putting a little bit of activation in again? And then we bring that in and track what's going on in the body, and then find what needs supported. So if I'm working online with them, it may be a blanket around their arm, around their shoulders, so they can feel like a bit of support, maybe a hand on an area that they're feeling things like. It's interesting, you were talking about, how we digest emotions. A lot of the time people are putting their hand on their stomach, because I'm guessing with, in line with what you're talking about, it's like undigested emotions are there. And then if I'm in person with them, I've got a table, I support them with my, physical hands, another being there. I think one of the quotes from Peter Levine is, trauma is when there's the lack of an empathetic witness. So, when we think of things that have been traumatic and hard, is to think about, well, what would the story have been like had I had somebody there that was empathetic, that was a witness to what was going on, So I try and be that for that person and allow the nervous system to, go through their waves and find their own settling in a way.
Yeah.
Yeah.
So when you're going through this process and I guess in some instances, you're getting people to remember incidents that they had buried, i.e. forgotten. How do you get people into that state where they can remember?
Well, it's like, say I have people that have sexual trauma and things like that. I won't necessarily go anywhere near. I won't go, remember that time you had sexual trauma. Won't be anything like that. As we talk, there's going to be a pattern of, I had to do something I didn't want to do, but yet I performed. So, there's fawning, which not many people know about, this appeasement to, shutting down your own needs in order to keep the other person happy. So, sometimes it's just that, okay, there's this pattern. Is there an example which we can use, an experience that you've had that's maybe like a 5% intensity, like to specifically not pick on something really big. And even before we get to that part, there's probably all this other stuff to work on, all these other bits, just to resource that person so that they know they can come back to settling their nervous system. So when it's like talking about big things that have happened, sometimes we won't get to that. It won't be appropriate to get to that for like 5, 6, 7, maybe not, never. You might not ever get to it. There's all this other stuff in between. Yeah, it's just not black and white. So
I guess the question I was trying to ask was, do you, for the client to remember something that's in their subconscious, do you have to take them through some kind of meditative process to get there?
No. If I'm having to go through those lengths, it's like I'm having to go in. And for me, it's more, let's allow the natural process. The body will give you what it's ready for.
Yeah.
I trust that 100%.
Yeah.
I don't need to go, I don't want to dig into it. It's all about being with that person's capacity. So if I'm having to like go into the subconscious to go on that level, that's the level I'm not comfortable with working at. There's a reason why it's on a subconscious level. Yeah. And it's more like, let's be with that. Let's be with, if it's really deep down, and, some people just be like, there's something wrong. Maybe there's something I've forgotten. Maybe something happened to me as a child. And, I'm not going to be like, it's not my job to be like, okay, well, let's think about it. Who can you ask? Let's try and figure this out. It's not about that. It's just to go with that, so what's going on in your body as you're thinking about this, as you're thinking that I don't know, what if something happened? And then there'll be like, there's this panic. And it's just like, okay, can notice how that panic shows up in your body, And then what you tend to find is that, people have a lot of resistance pieces before getting to things like that. And then what's important for me is that let's be with the resistance without trying to peel it back and without trying to make that resistance wrong, to just hold that space of that resistance is protection.
Yeah.
And that has really served you at some point. Can we be with that? It's okay,
Yeah. So what it sounds like to me is the work that you do, you're peeling the layers of an onion piece by piece.
Yeah. Based on the client. It's not based on what I think needs to happen.
Yeah.
It's based on the client and where they're at.
Yeah.
And I'd say like the resistant pieces to, well, that part doesn't want to do that. That part doesn't want to. And then it shows up. They dissociate. Suddenly they feel really foggy and, they can't feel their feet. And again, it's like, okay, let's notice that. Let's be with that. And if I think they're in trouble, it's like, okay, let's bring in a bit of movement. Let's switch things up a bit. But even dissociation, you can be with it and the body can naturally come out of it as well, given the right environment, I suppose.
It sounds like a very kind of gentle form of therapy.
Extremely, extremely gentle. Extremely gentle. It's not about getting in. It's not about, we're trying to come out of the mentality that we have of stiff upper lip and keep calm, carry on and, avoid. It's just like, okay, let's just notice, but we don't need to dig in. Let's just notice. Like we have conflicts, like one part wants to do this, one part wants to do that. And it's just like, okay, let's just notice. What is it like to just allow both to be here equally? And what people tend to find is like, oh, it's all right. It's, when we actually allow it, and even just allow the resistance I was just like, notice how that resistance shows up. And then it kind of drops because that part kind of knows, well, I can be here, actually. It's all right. I'm not bad. I don't need to be gotten rid of and things. So things start opening up. It's really developing safety on an internal level. Yeah. As well as, the outside environment. It's just letting within know it's okay. It's okay.
Yeah, it's interesting. It sounds a little bit to me like I would describe it as feeling therapy.
Yeah. Yeah. But, I can get people that can't feel. They have no concept of feeling. I can ask them, what does that feel like? They're just like, I don't know. And from there, it's just like we might, you can hear in their language, like if they say, I see this or I think this, it's just like, okay, do you get a visual? Do you get an image? Do you get a sense? Can you stay with that sense? So yeah, as much as somatic is the felt sense, sometimes people don't have the language for it. Yeah. And what's interesting is a lot of the time when they don't have the language for it, it kind of gives me a key to, we could be hitting into something that's pre-verbal when they're babies and they don't have the words. So to also hold that space as well.
Yeah. I guess, I don't know what your thoughts are, but someone that's not feeling, shall we say, it could be that that's just not their language. They might just be, for instance, very verbal or very visual, let's say. But also, I guess it could be that they might be a feeling person, but they just don't want to feel that emotion.
Yeah. I kind of believe that, if people are showing up to a somatic session, on some level, there's a concept of feeling. There's a concept of the felt sense, rather than that being not their language. It's that, there's something, if they're showing up for that, then I'm just like, well, we have to acknowledge that there's a part of you that wants to feel, because you wouldn't show up to a somatic session.
Yeah. I guess ultimately they want to feel better.
Yeah.
Right.
Yeah. And I think that's the thing, is that people might not know something. They'll have a felt sense of something's not right. And, it's just that connection of, what is that for them? How can they make sense of that? I suppose. Yeah.
What are some of the most common kind of reasons, or let's call them conditions, that people might come to you for?
So I've got people it's interesting at a time like this, post-COVID, a lot of the inquiries I get are people like, post-COVID, this has happened, like loads of stuff has happened. And I suppose the most common one is the chronic fatigue symptoms. where, the body, that fogginess, that fatigue comes in. And on a physiological level, or how we look at it on a somatic level, is that we've got massive activation going on and a part that just wants to shut that down. So there's this fogginess going on. So, I think what's happened with the pandemic is that we've all been functioning and, managing things. People, I think there's been a lot of, say, for example, I'll speak about my partner. I suppose he's close to home. Is that, my partner, he's a very sensitive person. There's been a lot of dysregulation in his nervous system, and he's found lots of ways of managing that. And then leading up to COVID, we got broken into, so that's a big shock. Going into lockdown, pandemic. And, these things that a big rupture, basically, is what we'd call it, like a rupture in the nervous system where this dysregulation just comes out. And so symptoms start coming out like vertigo, nausea, panic attacks, brain fog, not feeling like you can go out and be in the world, like needing to rest lots and things like that. Like the body's shutting you down because there's so much activation coming on. So, that's generally what happens for people with the stress disorders. So, and that's what I'm seeing. Well, that's my work, really. People that have managed and then started to realize, something's not right. I'm now got palpitations. My heart rate goes up quite a lot. I'm now highly strung, don't have the capacity, and things like that. So, I think it's interesting at the moment. There's a lot of post-COVID effects, which I think we're going to continue seeing, basically, because the effects of being in a global pandemic, we're going to see that, down the line more and more and more. And just our coping strategies have been really hit with a big rupture.
Are you a personal trainer, exercise professional, or medical professional who wants to upskill and take your knowledge to the next level? And would you like to take a class and be taught personally by me? I'm, of course, talking about Czech Integrative Movement Science Level 1 in Lancashire, England, on the 25th to the 29th of October 2023. I'll be teaching a clinically tested system that makes sense of the entire health and fitness journey, from anatomy to assessment to program design and coaching. You will learn 40 assessments, 60 conditioning exercises, and 27 program design principles. And the Czech framework brings them all together into an incredibly adaptable and effective system. From assessments to exercises to program design and coaching, this is a complete system. Students who master that system can create powerful programs that are tailored specifically to their individual clients' needs, abilities, and motivations. If you're serious about your work and want to take it to the next level, you can enroll on Czech Integrative Movement Science Level 1 with me in Lancashire in the north of England on the 25th to the 29th of October 2023. And you'll need to enroll by the end of June to complete the 3 fantastic prerequisite online classes: program design, scientific core conditioning, and scientific back training that will prepare you greatly for your IMS1 class. For more details, check out the link in the show notes. But don't delay, places are limited. I hope to see you there. Would you say that anxiety is a major thing that you've seen in the last few years?
Definitely. And I haven't heard him specifically. This is hearing it from another person, so don't quote me on it. But the Dr. Lawrence Heller with the NARM, the neuroaffective relational model, he will talk about anxiety as actually being anger a lot of the time, being a lot of repressed anger. And, we only have to ask the question of, how was anger met when you were at home by your parents when you were little? To know, anger wasn't, for the majority of us, anger wasn't okay. So a lot of it's been repressed. A lot of it we turn it inwards. We make ourselves the bad ones in order to preserve our relationship, in order to preserve our attachment to our primary carer. So anxiety is massive because I think we're not a society that's okay with anger, like a healthy expression of it or not. Yeah.
Yeah, it's interesting. I never heard anxiety discussed in that way. But my kind of understanding is that anxiety is a fear of what might happen in the future, whereas depression is a fear of what's already happened.
What's already happened. Yeah. When we think of depression, they'll talk about it, energy that's been depressed, things that haven't been allowed. So all of it just creates dysregulation, emotional dysregulation. So people are going to panic going forward, like not being able to be present, basically, because of all this dysregulation going on in their system at the end of the day.
Yeah, and I guess there's just as much fear propaganda now than there was 3 years ago. At the moment, it's just changed to a different subject.
Yeah. What's the latest topic at the moment?
Well, there's many, isn't there? I mean, you've got central bank and digital currencies and digital IDs, the 15-minute cities, the ultra-low emission zones.
Cost of living and that.
The massive. WHO treaty, there's potential banking collapse of the fiat currency, all that going on.
Yeah.
How much of it will ever happen, who knows, right?
Yeah, but what's happening is, like you say, the fear comes in, and it's a lot of stuff that we can't control. So there's so much disempowerment there that brings in even more anxiety.
I mean, the one thing that I'm definitely not anxious about at all is if we end up with a nuclear war, because there's nothing you can do. There's nothing you can do. So I'm just like, whatever. If it happens, it happens, and I'll see how I get on in my next body.
Yeah, exactly. Yeah. Yeah, it's interesting. I've worked with somebody who, they get very upset with what's going on with governments and things like that, and then to actually like take the narrative away and be with what's going on in the body. Like notice the sense, there's a sense like this injustice, there's this, disempowerment and all of this stuff. And what's interesting, it leads all back to their primary caregiver. It leads all back to, feeling all of that when they were little, this complete disempowerment. So yeah, it's interesting. It's an interesting space to be with.
Is that similar? Is that example someone that was quite controlled, did you say? Yeah, and
very fearful of their primary caregiver. The primary caregiver really dominated them, like the lack of safety, no control over it, feeling completely disempowered. So it kind of resonates out to now as an adult for him, to feel that as well, to just go, oh yeah, there's that injustice. Is it all right to feel that? And often we come back to a younger part that's just like, and needing to express, that, and giving that space for that part to be heard, to be expressed, and to be held. Yeah.
That's really interesting. Can you possibly share the example of someone that you would say made the biggest gains, shall we call it, with somatic therapy?
Biggest gain. I love it. It's like trying to bring this into like PT terms, where it's just like, it's so not black and white. Biggest gains, I think, just like I said with this client before, having worked with them for a few sessions, and to see this natural pendulation coming in, to me, that's huge, because it tells me that in future when they hit, life is always going to pop up with challenges. It's how we're able to deal with it that counts, and so to me, seeing that is a massive gain. Seeing that is really rewarding for me, to know that, okay, that their body's having this capacity to deal with activation and actually find resource again naturally. So that's really beautiful to watch. How to quantify a massive gain, I don't know. Witnessing people, I've had a few women who, now newly diagnosed as neurodivergent or ADHD, finally finding, acceptance of where they're at, that they're not the issue, then there's not something wrong with them. It's more that their environment just wasn't able to support them when they were younger, but seeing how that affects how they are with their children. Seeing, to me, that's a massive gain, just seeing how the effects of how they work on themselves and their nervous system influences how they are with their children. And I think, a lot of us are carrying the dysregulation of our parents, of our grandparents, of our great-grandparents, who have been in World War I, World War II. We only have to go a couple of generations back to witness that. So to see that happen, where they're changing that narrative, that they're not going to project their stuff onto their child, like that dysregulation onto their child as much. I mean, it's not going to be perfect, but things like that to me are massive gains. Another massive gain is witnessing people switch their relationship to themselves, having heard them talk about how much they hate themselves, how they hate this, how they're disgusted and all this, to actually go, I love myself.
Yeah.
That to me is a massive gain. So yeah. And it's not to say, hey, have a few sessions and then life's going to be rosy. There's still going to be challenges, and you're still not going to, go through it perfectly. I've got somebody who's really trying, and then just like I'm really upset with how I carried myself in that conversation. I could have done it better. And there again, we see that pressure, to just have compassion. I think for me, the massive gain is when somebody starts to experience self-compassion, self-love, starts to take it easy on themselves, starts to come out of, society's hustle of, go hard, just do it, push through, and to actually take a step back and really look after themselves on that level. That to me is a massive gain.
And do you have an example of a client that's come to you in physical pain and that's been resolved through somatic therapy?
To be honest, I haven't had anyone that it's resolved completely. And then also it's hard to see because they also go and I've had somebody, we had a beautiful experience. She'd been having niggling back pain online, worked on it on a somatic level, got her to put her hand around her SIJ just to feel into that. And then she started feeling her hip flexor start to relax. And then she had the memory of seeing an osteopath and doing an exercise where she had to push her leg against something. And she said it was absolute torture, which again, if you're going to use that word, that's a pretty big effect. And then she was, her hands were like doing some of this. She was like, oh yeah, it was too much. And I was like, slow it down. And here you got, she starts expressing a boundary of it's too much. Stop, it's too much. And then slowing that down. So allowing the body that space to actually go stop. And then she started to feel her hip flexor just stretch out and start to feel her back soften. And so from the beginning of the session, I think she described her back areas feeling lumpy and crunchy to being smooth and open. So, and then as time's gone on, it's just got better and better. And then she's gone to see physios that, have done some physical stuff, which has also helped. So I can't really say like, hey, yeah, the somatic work's done it massively. But yeah, there was definitely an emotional component there that came out organically without me having to go, have you experienced trauma here? Like, what's happened in here? Have you had an injury? I didn't have to say any of that. The memory comes itself. And then their own understanding comes itself. So it's really beautiful. It's really empowering for the client to have the felt experience of it. So the felt experience of empowerment as opposed to, that makes sense.
Cool. So something you mentioned earlier was when we went to that psychic circle, I think it was about 13 years ago, I think. And obviously, I've got my own recollection of that meeting, and to say that you blew me away was an understatement. I mean, I even surprised myself that, that I came up with some stuff. I could see stuff myself, but
Yeah.
We were in a room of predominantly professional psychics. I think there was probably 30 in the room, and I think 20 were professional psychics, if I remember right.
Yeah.
And without question, you were the most accurate person in the room. There was no doubt about that. And I do remember when I left, you were talking to the guy whose deceased father came into the room, right?
Yeah. I think it was his mother.
Oh, was it mother? I was thinking it's father.
Mother. Yeah. Bryn. He was called
Right.
Bryn. I remember his name.
So what I would like is for you to share your side of that experience, because obviously I've got my own recollections. You even told me that was wrong because I thought it was his father, it was his mother. But yeah, can you just share your experience of that meeting?
That meeting. So I think we were sitting in the middle of what was a big circle. Directly in front of us was the facilitator and the and the guy that came off the street wanting a reading. And then people, we did a meditation, didn't we? We did a meditation, brought in some colours, grounded, and then he went round the room. And always with speaking in public or speaking in groups, I get really nervous anyway, like this podcast, for example, I get really nervous. When it would come out to me, I was just like, I've got nothing to say. I just feel like all this energy through my body. I don't know. And maybe I'm just nervous and stuff. And then when he got to me, I said to him, I'm just noticing lots of energy in this room. I'm very new to all of this and don't really know what's going on. Just got a lot of energy going on in my body. And I thought he was just going to move on to you. And then he said, no, hang on. Like, do you have anything you want to say to Bryn? And I just looked at him and I just remember just verbal just all this stuff came out. And it just felt like I don't even know what happened. It was like tuning into something. And, all this stuff just came out, and he was crying. He was, and then and then it stopped, and then he moved on to you, and then somebody else, and then I was like, "Excuse me, I've got a bit more." I'm remembering it as I'm telling you. There's this sense of him, like being weighed down with responsibility. I could feel my body like getting pulled down, and like there's all this responsibility, all this financial stuff. And he was just sitting there crying and stuff. And then I was just like, okay, I'm done now. And I remember like looking at you and you just going, what was that? And I was like, I don't fucking know. And then talking to him afterwards, and he was just like, everything you said just hit something. Everything you said was just so true. And I was just like, oh, okay. And I'm still a skeptic. Can you believe?
I mean, my recollection was that he was an alcoholic, wasn't he? And
he'd had some. I think it was there was gambling.
And he just got his life sorted,
stuff like that going on.
And
so
I remember
details,
when I was in the meditation and the spirits were invited into the room, all I could see was floor plans. Now I did technical drawing at school, and I took that into one of the jobs I had before I got into this industry. And so to me, I'm used to seeing floor plans. So I thought I didn't see anything. But a few people went before me and they were saying, oh, I could see someone building a wall. And someone else said, I could see floor plans. And someone else said, oh, yeah, building a wall. Yeah. And then when it got round to me, I kind of said, yeah, I saw floor plans as well, but I couldn't make sense of it. And basically what it was is that this guy, Bryn, was rebuilding his life. He'd been an alcoholic. He'd gotten over that, and now he was building a new life. But then obviously, I can't remember, you say it was his mother. Had she recently passed?
Yeah, I think so.
Yeah.
Yeah.
So, but the amount of detail you came out of, it just blew me away. And I could see a lot of the professional psychics were looking at you as if to say, who the hell is this? because you were just so accurate.
Yeah.
Yeah. So yeah, that was
fun.
That was
Do they
quite
still do
entertaining
them?
for me.
Yeah. Do they still do them?
I don't know. I
They're
don't know.
probably online now.
It's the only one I've ever been to.
It's the only one I've ever been to.
Yeah.
Should go. Just do it again.
Should do.
I have delved into that world. I sometimes still pull out some tarot cards, do readings, and it is like I just tune in, and my partner was saying my voice changes when I go into this place, and things just flow out. And it comes through sometimes when I'm working with people as well. There's a resource. There's their dad. There's their granddad. They're here to support. Can we bring them in and for them to know that they've got extra support that you can call on has been really cool. And actually, I did start for Christmas as a little Christmas thing for my clients. I offered a shamanic journey for them. And the things that came out, I was just like, oh my God, like this stuff is so still the skeptic in me is like, it's doing something. Like people are shifting when I'm doing these shamanic journeys. Even one person came back to me going, what day was that? And I said, oh, it was on the solstice. It was the 21st. And he was just like, because the 23rd, something massively changed and I started feeling more positive. And this person now, like, who has basically like hated their parent is now appreciating their parent, appreciating them to a degree. Like, yeah, it's been really cool. So yeah, I'm weaving it back in.
It sounds to me like you need some somatic therapy to get over your skepticism.
I think so. I think I kind of know where that's going to lead. It's going to come to like some dad issues. Yeah. I mean, even my dad the other day, he was just like, you're a bit weird and stuff. And it scares us. It scares us. I was just like, I'm scared myself. So, but yeah, you're right. I think some work on myself there just to be comfortable. Having to trying to just come to a place of all of this is me, and how can I offer that and be of service? Something I've been playing with. Yeah, for sure.
It's interesting that you mentioned tarot, because I don't know if you're aware, but Paul Chek is very much into tarot.
Yeah.
For those of you that don't know who Paul Chek is, if you listen to episodes 11 and 31, you'll find out a lot about him. But yeah, it's interesting that you're very intuitive when it comes to the tarot as well. Yeah.
Well, that's through Paula Shaw. I think people do a little plug for Paula as well. Soulful guiding. Yeah. You've had sessions with her as well.
I've experienced Paula's work. Yeah, it's pretty amazing.
Yeah, she's phenomenal. Yeah.
So before we wrap up, is there anything in particular that you'd like to add?
Not really. I think the purpose of today for me has really been to just share the work of somatic therapy, because I'm aware a lot of people still don't, a lot of people don't really know much about it, and trauma work and how we can, the support that's out there for things like the anxiety, stress disorders, overwhelm, and just to encourage people to have a look for a somatic therapist, support them in a different way, because life is tough, especially now with what's been happening. And I think we could all do with a bit more support. It's just smart, really, just the smart way to live. Yeah, so
definitely. And what's next for you, Liz?
I don't know. I think. Yeah, what you've touched on, me getting some somatic work to just embrace all that I am, weaving in. I'd love to be able to weave all that I do in to my work, and not just be a somatic therapist, not just be a personal trainer. So that will be it, I suppose, and see what happens from there.
Yeah. So it sounds like you might need to let go of that skepticism to be able to do that.
Yeah. I'll keep a bit of it. I think it's healthy to keep a bit of it.
Yeah, for sure.
But yeah, to not stop me from doing stuff.
Yeah, I mean, my experience is that you've got a gift. Now, I'm not saying for that reason you should use it. It's down to you, but I definitely think you've got a gift there.
Thank you, Leigh. I really appreciate you saying that. To hear it from somebody that's witnessed what's happened, what I've been through. Not many people know. I suppose even my own family don't really know about these parts. So I appreciate that. Thank you very much.
And where can people find you online, Liz?
I'm at somaticwellness.co.uk. I have got Instagram, but I've not been great on social media. So if they want to get in contact, I'm happy to have chats with them, 20-minute chats. I'm in Guildford. I see people face to face down here. So I'm
and you work online as well.
And I work online, And I'm happy to, if people got any questions, I'm happy to answer questions. And your
Instagram is Liz Wong.
My Instagram is Liz at Somatic Wellness.
Okay.
But great. There's not much going on in there.
They can always direct message you from there, can't they, if they want to?
Yeah, they can find me there, but there's not much info on there, I'm afraid.
Yeah. Yeah, maybe you need to get over your skepticism of Instagram.
There's no skepticism. I'm also just trying not to put pressure on myself to go there to do. I mean, it's brilliant watching people, always posting. And when I feel like it, which isn't very often, and to just be okay with that for me right now.
Yeah, cool. Yeah. Liz, thanks so much for today. I've really enjoyed today's session.
Me too. Thank you for having me.
No, it was a pleasure. So that's all from Liz and me for this week. But don't forget, you can join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.